Okay. Welcome, guys, to another episode of Consciously Curious, where we break down those that are thriving in their passion. Today, we're going to deep dive in occupational therapy and physical therapy. We got Nancy Crivellone, Crivellone and Catherine Dail, I guess, whatever you prefer. But they just came out with a book. Congrats, guys. I saw it on Amazon. I told you guys last time I saw you, it's like, it's on Amazon.
Yes, thank you.
Thank you so much.
Congrats and welcome to the show.
Yeah.
For those that are just listening and not watching, can you give a brief intro to so they can connect the voice to who's who?
Absolutely. I'm Catherine Crivellone and Dail. Like you said, I am the occupational therapist, the voice behind the occupational therapist.
And I am Nancy Crivellone. I am the physical therapist, and I am also Catherine Dail's mother.
A dynamic duo.
Yeah.
And how long have you both been practicing in your respective spaces?
I've been a physical therapist for 32 years.
Okay, we got some authority in the room right here.
Yes.
I can't even believe it myself, but yes.
And this will be going into my 5th year for practicing occupational therapy. I graduated in December of 2015.
Okay.
And started working in a school-based setting in May of 2016.
Great. And you're both in the school setting?
Yes,
okay.
yes.
Okay. Nancy, have you been in other settings?
I have been in other settings.
Like hospital settings?
Yes,
okay.
Yes. I started out in acute care, which I loved. I've always loved being a physical therapist. I've always loved working with people. And then after my daughter was born, Catherine Dail, then I had to work just weekends for a while, so I went into rehab for several years. And then when she became a school age, I thought it would be good to have the same hours as she has, so then I started in the school district. And I've loved working in the school district. I love
That's
working
amazing.
with children.
How hard, or it seemed like it was easy, but was it very easy to just bounce around like that to different parts of the industry?
It was an easy transition.
Okay.
Because I was very nervous when I was going to start working with children, but the principal of the school that I worked at that time, she was so encouraging to me, and she just said, what I say is just look at them as little adults. And that helped make me feel more comfortable.
Right.
But still, it took a little bit of
a learning curve?
A learning curve, but after, I just loved it so much, and I really couldn't see myself working in any other setting.
Okay. And for a while, a long time, I myself didn't know, and we talked about this before, but can we, in your own words, kind of break down the major differences between PT, OT?
I'll let you define PT first, and then I can, because I think more people know about physical therapy, so I think hearing something familiar and then a little bit of the juxtaposition will help.
Yes. I feel like the best definition I could give as a physical therapist is our primary goal and role is to help a person who has a disability or who has had an injury or who has had something happen where they have lost mobility, is to help them achieve the highest level of independent function that they possibly can.
Yeah.
Also keeping in mind what their goal may be as well, and trying to get to that point. For example, if it's walking or getting up from a chair, or we do work on a lot of independent functional skills. Yeah.
I hear that, and it's just there's a lot of overlap, and it's kind of messy a little. So how can we? What's the main? How do we distinguish? Or is it? Do you just collab like that all the time?
I feel like we do. However, because I went to physical therapy school in the 1980s, that I felt like we were sort of taught more of a holistic approach.
Sure.
And sometimes now I feel like that we may have divided up the body a little bit, where physical therapists might work solely on what they call the lower part of the body, which encompasses walking and sit to stand and getting out of bed.
Sure.
Whereas I think you are right. We definitely can overlap a lot, and it's wonderful if OTs, occupational therapists, and physical therapists work as a team.
Yeah.
So then we can really achieve everything that needs
whatever
to be.
is in the patient's best interest.
Exactly.
Do you feel like that's the case across the industry, like in the hospital setting and the home health setting, is like it's very integrative between the two?
I think if it's a well-run hospital, then it is. I had a professor say, if someone's getting PT, they should probably also be getting OT. There should really be, I mean, there's multidisciplinary, interdisciplinary.
Right.
There's different models, but we often will collaborate. And you see it even in a school setting where you have teams of different professionals. So, not every student we work with will have all the professions, but given what they need on a case-to-case basis, we will be working together. In the school setting, we want to support the teacher, so we have to look at the academic goal and see what we can do to help a student in the academic setting. Something my mom said is something that I know we talked about before, where it's become a thing where PT's brought into lower extremity and gross motor, and OT's been brought into upper extremity, using the arms and hands.
Okay.
And it's not true. It's just not the case. There's a lot of, both professions are working on functional independence. How I view the distinguish is sometimes I see OT working on more task-specific goals. So, the PT might be working on getting out of the chair, whereas OT, okay, we're getting out of the chair to do what? What do you want to do? You're not just going to get out of the chair to stand there. What's your occupation? So whether it be creating podcasts, how are we going to get you to use your body to bend over and pick up the equipment, to set up the machinery, or, different functional tasks like that. So I think that's a big difference. I would think it's, when I view PT, and I could be wrong, I see how they're trying to build muscle and that anatomy, physiology, kinesiology aspect, really honing in on that, where what I was attracted to occupational therapy is I view a little bit more of a creative, arts and crafts, holistic view.
So hearing this, Nancy, it's like if you had all the wisdom at your disposal before going into school, like, how does that appeal to you? Like, what, or do you already integrate that into what you do now? It's like,
I feel like I do. I feel like physical therapists do in a different way.
Okay.
And when I observe occupational therapy, I mean, there is a little bit of envy there, because I do think there is a little bit more freedom for them to be creative when they're dealing with children. Okay. Whereas I feel like where my creativity comes in is having to come up with exciting activities that will motivate the person to participate.
To bring build a context around what they're trying to accomplish.
Exactly. Okay. That's perfect, Victor. And the other thing with occupational therapy is I do feel like they are more knowledgeable when it comes to mental health issues, if I can put it that way. Whereas with physical therapists, and maybe that sort of is part of the mental health, because I sort of look at the relationship more between student or client and the therapist, because I know it has to be a good relationship, that the more the student or adult likes you, then the more they'll want to work with you and participate you. So in that way, I feel like
it feels more natural for them, for the interactions through.
Well, and occupational therapy in our curriculum, we have mental health and OT. We, depending on the school, and I'm not up to date what it is right now in 2020, but a lot of programs, you have to have some type of psychosocial,
like clinical
work. Right. I personally chose that and did a lot of my clinical work in a mental health setting.
Right.
We do focus a lot about therapeutic use of self. And then going back to an example how PT and OT can both be working on a functional task, but our notes and what we're looking for might look different. So my mom's example of getting up and standing, and let's say it's standing at a kitchen counter to do a kitchen task, the PT, can do that, but they might be looking at, how much assist and effort it was to get in and out of the chair, as would we, but I might be looking more at maybe in this realm of cognition of how many steps or how long it took to create this kitchen task, how was their left side, were they paying attention to their full counter safety? There's just so many different areas that you look at.
That's a lot.
It's a lot. It's really, I mean, all the areas of the body, really, motor, cognition, vision, sensory,
how much, and this is just a side tangent, but how much self-awareness did that bring to you, being responsible for someone else's awareness? Like, did that benefit you all? Like, did you notice that, like, in your own personal lives, like, you notice, like, the subtleties that probably most people miss?
Are you speaking of
I guess I was just like from the
Yeah.
anecdote that like Kat just mentioned, or I'm sure like when I was building this setup, like he's bending down in a weird way and like he's using his back and like, things like that. Like, but when you have to when you have to call someone out on their, not insecurities, but like when they're on their weaknesses, I wonder if that like brings about like a certain amount of awareness in your own day-to-day lives.
I think that it does. However, I try very hard not to do that because I once said to someone as a physical therapist, I feel like sometimes you're always looking for what's wrong.
Okay, yeah.
You are, because why aren't you progressing? What's wrong with this picture? Right. What's wrong with your balance? What can I do to help? And after so many years of doing that, you start looking at everything as what you're saying. What is Victor doing wrong when he's setting up this equipment? and I don't want to do that. So I'm sort of teaching myself not to do that.
I think there's a fine balance between being aware of it and then giving unsolicited advice.
Exactly.
And if you come across someone that's open to always just like, how can I improve? Like, but I think it'd be offensive to most people.
Exactly.
Yes.
Exactly.
Yes, and I completely agree. It's easy to nitpick, and I think in general, just being self-conscious. I think we're already so hard on ourselves. But yeah, when you're in a profession where you are looking at certain body mechanics, or or even psychology, it's just so easy to really be hard on yourself. And I think it's great to have a different mindset. I think my mom and I are really good at looking at the positives. So I think, this isn't a generalization, but I think healthcare professionals can sometimes be the worst patients in hospitals because
absolutely. Well, they don't take care of themselves.
Exactly.
And I think it's also looking at what can you do, and it goes along with the book. But so many healthcare professionals, they'll be complaining about something like, oh, what do you think of my child? Or, they're already doing this and they can't do this. And it's like, let's relax. Everyone take a deep breath. What if you didn't have all of this knowledge in your brain of human development, and you're just you're like perseverating on what should be and not looking at the bigger picture that humans are just so different in general and take their own time to develop. And so I like the mind shift that we have of looking at the other side, the positives of what you can do rather than what you're doing wrong.
Oh, as an educator, like if I'm about to give bad news, I'm like, well, what's the good news? Like, what can I just throw in there to like ease the blow?
Exactly. Definitely have to do that.
And so over your time, I mean, what's been your? And I guess to rewind, you mentioned mental health, and the last time we talked, like that was a huge inspiration for you to get into this.
Yes.
And was that the main like reason for why going to OT as well instead of PT, because of how involved mental health is with that industry?
Yes. I mean, if I could just tell a quick story. Yeah. I think when we talked, I told you my grandfather, my mom's dad, was a veteran in World War II, and he fought in the Battle of Cassino and was shot in the head. And, he didn't die, he survived. But of course, medicine and therapy wasn't what it is now. And he had a plate put in his head, the plate shifted and caused a stroke. So as I said, therapy, he always lived a life with that spasticity. So meaning that the left side of his body was always very tight against his body. He didn't really have use of his left side. He had to wear special foot braces. He used a cane to walk, and so growing up and being around him, it was never strange to me that, my grandpa, who I call Pat, moved differently or needed help from other people. Right. It's just how he was. And he always had a very independent spirit. So even though he did need help with showering and bathing and grooming, getting dressed, all these things that we work on in our therapy setting, he really wanted to try as much as he could. So even if it took him an hour to shine one shoe, he would do it. And I wanted to find a profession where I can instill that type of beauty and independence.
Hope.
Yeah. that he somehow, to me, and maybe as a kid, maybe he didn't naturally have this, maybe it's something that he had to learn, but in my eyes, it was just so natural to him. And I just wanted to give that to others. So all these things I saw my parents doing or that I was doing to help him, I just wanted to keep on doing that. So I felt, why not make it into a career? And yes, veteran work is very important with occupational therapy. The profession started in 1917 because of the veterans coming back from World War I and working on arts and crafts. So there's an arts and crafts movement, making sure that holistically the person was sound mentally, but also working on those physical components through leisure. And that's really what occupation is getting a person back into what they want and need to be doing, And I think as times have moved forward, there's been a lot of that science and medicine, which makes sense. You want to have evidence-based practice. You want to know what you're doing, why you're doing it. But sometimes it seems at the cost of what? Like, well, there's certain assessments or therapy modules or preparatory activities that, there's a science behind it, but you're not really working on occupational performance. So I'm very much so, my school of thought is to really work on functional tasks. So to help train the brain and body to move. Of course, I'm using my evidence-based research.
It sounds good to me. Yeah, it's personal experience as well. But like, I wonder if that can be a standard eventually in the industry.
Yeah, and I think going to conferences, that is a little bit of I wouldn't say a battle by any means, but I think there's a lot of keynote speakers that do talk about getting back into more functional performance and these occupation-based activities. And I don't want to speak for the profession, but maybe letting go of some of these hypes and vendor-based therapy models. You know what I mean? Just
can you elaborate? What do you mean by vendor-based? Like people are selling equipment type things, or rather than keeping it simple, or.
That's what I hear you saying, that you want to keep it simple, do more hands-on and less of these equipment.
Well, I think it's important to generalize. I'm trying to think of an example. So in school, a lot of times handwriting is a big thing that comes my way as an occupational therapist. And I understand the thought behind it because it's a very, visual motor, visual perception, visual closer activity. There's a lot of, you have to have good core, you need to have good proximal to distal development, you need to have a strong, fine motor to hold the pencil. There's really,
right.
There's a lot to it. There's a
Yeah.
lot to it that you wouldn't think. And there's a lot of different methods to work with that, and, fun activities. And I think, but if you look at some research, practicing daily and having family involved and teachers involved is how you're going to also improve some of your handwriting.
Absolutely.
And using other models like play. Play is a child's primary occupation. So
primary language.
Yeah.
I never heard it as that, but that makes so much sense. Yeah.
So a lot of times I see in curriculum of having preschoolers sit down, like, this is how we're going to get them to write. So yes, practicing writing is important, but I think you need to start somewhere developmentally, start with the play and get a child to build their core muscles and their gross motor and fine motor muscles via their play, climbing and jumping, sensory exploration. So, a child knows how much pressure, how hard they're holding a pencil, and through this primary play, then you'll start to get into this handwriting. I know it's not necessarily talking about the vendors, but going back to the basics of what humans need in human development.
Yeah.
And making the task very functional. Yeah. And like I said, you still have to know science behind it. So you have to know patterns of development, or, if you're working with someone with a stroke, typically what's the body going to do once it starts the healing itself? And so, of course, you need to base your activities around what you know about anatomy, physiology. But I think for OT, getting back into that more holistic, making sure that you're maintaining that whole person that you're treating.
Okay. I hear that. And I get a sense that you spend a lot of time with each client, right? And sometimes you can be overwhelmed by the number of clients on your plate. And so who dictates that?
Well, in the school district, we're just given a caseload, and they do try to make the caseload manageable.
Okay.
And sometimes it's because other things come up within the meetings come up,
Sure.
the report cards come up. There are other aspects of the job that I think eat away at your time more than the actual time that you spend with the student. Because I feel like we do get a good amount of time that we are able to spend with a student, especially within the school district. We're able to see them in their natural setting, because school would be their natural setting for the students that we're seeing. And you're able to go to gym with them, or the music class, or computer, or transitioning, or the cafeteria.
Right.
So you're really able to see what you need to work on, what's most important. So that part, I do feel like we are given the opportunity.
Okay.
It's just the other things, like I said, that come up when you're in the school. Meetings can take longer than anticipated.
These aren't things that you think about in college, and like pre-OT, pre-PT. You're not thinking about like the mundane, menial tasks that you have to be responsible for.
And I think that is important to note, because, hearing us talk about OT and PT, and you can hear we have a passion, you can hear how much it helps people, and we really love our work and working with people. And I think that's very appealing, to those that want to get into some type of nurturing profession. However, like with any job, I'm sure there's still a part where it's a little bit out of your control. So in the hospital setting, you have insurance, right?
Yeah.
So insurance is going to kind of dictate, okay, well, you better see this person for 90 minutes a day, depending on which setting. Acute to inpatient, they're going to have different times. To a SNF, like a skilled nursing facility, there's going to be different demands of how long you should see a person. Turnaround time for getting an evaluation done. I know in my hospital experience, it's 24 hours to get an evaluation done. You're also ordering equipment. You also are attending meetings with the staff and team to have, what we talked about earlier, those interdisciplinary and multidisciplinary meetings, just to make sure everyone's on the same page.
That's so cool. That's awesome.
Yes. But
what other professions are in these integrated meetings?
It's usually, if the student is receiving all these services, it would be a physical therapist, an occupational therapist, speech therapist. There could be a vision therapist there. There could be an audiologist there.
Wow. Social worker, nursing,
then
special education teacher, general education teacher.
The parent.
If
the child is 14 and older, they're also allowed to attend the meeting, which is good. So they can. It's always nice for a child to hear a lot of nice things about themselves.
Of course,
It's very motivating for them.
Yes.
That's a lot. And do you feel like, because a lot of the meetings I'm in, they're just like, why am I here? But like, I feel like those are pretty productive meetings.
They are.
They are.
They really are. And plus the parent is there, so you can hear their concerns. You can hear what's going on in the home district, their home setting, what might be some challenges that they're having. Because sometimes you could not be having the same challenges at school that a parent is seeing. Yes. And it's kind of nice if you're able to have a goal that sort of lines up what the parent would like to see, and even more so if the student's of age, what they would like to see. What are they hoping for? Maybe now that they're a teenager, you can help them with going to the school dance. There might be something walking across the stage for their graduation. And when you're with a student one-on-one, I feel like they do reveal a lot to you, but it's also nice in the other setting to hear when you're in the meeting what others are hearing as well.
Right. And so in the school setting, do the parents have to pay anything extra for these services?
No.
That's amazing.
No.
Wow.
So usually the parents are given just kind of like a consent form to sign, or they sign off that the state of Illinois will reimburse our services in the school.
Oh, wow.
Yeah. So, I mean, we don't get paid based on that. We just have our salary, but the school, the district will make more money off of our services knowing that they're getting paid from the state.
Okay.
Yeah.
And in different settings, do like outpatient or hospital, like do insurance companies have a cap or a limit as to the number of visits a patient can have?
That is my understanding.
Right? That's how frustrating is that? Because this isn't an overnight thing. Like, you can't just do like 5 sessions and call it a day.
Yes. And it's been a while since either of us have been in the hospitals. And that's something, that's policy. That's something you have to look at every year. And I know when I was in my doctorate program, they talked about lobbying and going to Capitol Hill and making sure that either get rid of the cap or extend the cap. So I'm sure that's also depending on what insurance you have and where you go.
How like that to increase accessibility, especially to those that are underserved and can't get to these. So it's really cool that the school district does that.
Yeah.
Absolutely.
Yeah, and I just want to make clear, if the parent should not sign that paper about the reimbursement, they still get their services. They're not denied services for any reason.
What are they? So what are they denying, or what are they?
Sometimes a parent may not sign it because they feel like it'll hinder what they're able to get in the hospital setting or in their outpatient setting, which usually is not the case. But if they don't understand that and choose not to sign, that's fine. They're still going to get their
that's good to know.
their services in the school.
That's good to know. And so can you tell me a little bit about the book? Like, what was the main like motivation behind the book? And I guess you haven't found a book like that.
Well, to be honest with you, we really didn't search to see if there was another book like that. I mean, really what brought it about was, in all the years I've been working in physical therapy, and then the years that Catherine's been an occupational therapist, so many times I'd be with a student, and this is directed towards kids, but I have to say it's also happened with adults too. And someone would walk by and say, because in the school setting, it's much more open. You're like, if you're in gym, you're out in the open. There's other people who are seeing you. It's not like such a private setting.
Yeah.
And then people would say, "What's wrong with him? What's wrong with her? You know, can she walk? Can she? Why isn't she?" And they'd be directing the question to me or to Catherine, but never to the student.
Well, that's very interesting. So, like, other students are also aware of who you guys are, even though you're not. Are you like, how much contact do you have with other students?
They may not always be aware.
Okay.
It's just, but a lot of them are too. I mean, it's because they're really, it's called pushing in. They really want therapies to happen within the classroom versus being outside of the classroom, because that's the setting that they're in. And that is the role of physical therapy and occupational therapy. With that independent function, the independent function is within their school environment.
Okay.
So if it's transitioning from one classroom to another, then we would be in the hallway with them and seeing how they're doing on a flight of stairs
And
that is crowded.
Other students are just observant of that.
Just observant.
Okay.
Right. And especially young children. It's not meant to be mean.
No, I know.
They just don't.
Yeah.
They just haven't been educated to talk to the student, to talk to their peer, to speak to them.
And this is the main reason for the book.
Only because it had happened so much. And then one day a coworker, I was treating a student, and another kid came by and said, "What's wrong with him?" And then finally I said, "We have to write a book about that." It's more of a
Or the question could be, if it's not as blunt as "what's wrong with you" or "what's wrong with him or her," it could come in, "Why can't they walk? Why can't they do that?" Or how come you pick them up? And of course, it's also important we always keep confidentiality and privacy. So it's not like, other students don't know, oh, so-and-so is being pulled and they're getting occupational therapy for this and for this and for this. That's private information. We still adhere to HIPAA. But again, it being a very public setting, children see and they're observant. Like, I want to get out of my class, or, oh, it looks like they're having fun over there and playing with balls, or, I want to do that. And so it's just a child's curiosity.
Of course.
Is what happens. And I think that's why, when you hear this over and over, and then as being empathetic, you feel so bad for the child who's working on this, and this child might be so proud that they finally kicked a ball, and still someone's asking what's wrong with them, So it's really a book about educating children. I mean, of all. I mean, we didn't put an age limit on it. Just to me, it was like of all ages, of all types of children.
It's very applicable,
and even adults. Because when I read it, I think other adults would like to hear this. Adults raising children who maybe would be considered, my quote unquote typical developing, just how to interact with other children in their school who may look or think differently.
Right.
But also I think it's very comforting for parents to see representation of their child in a book, and a tool to help them as well, and to help their child to advocate and have empowerment.
Yeah.
Yes, because when we were first doing this, I said to Catherine, what's wrong with you? And she goes, well, shouldn't it be what's right with you? And I said, yes, we know that, but that's never the question. It's never the question that's asked.
It's a big like shift in perspective.
Yes.
And so do you find yourselves educating more with other students rather than your own students sometimes about this? Like anytime there's an opportunity to help shift someone's perspective, you take it.
You do take it the best you can.
Yes.
But it's also it's also awkward.
How so? Because I can't believe that they're inherently mean.
No.
Right? Like we've established
No.
that they're naturally curious. And so if they're open-minded enough, like, and we explain like, it's not necessarily wrong. It's like, this is right.
Exactly. Yes. But it's sort of what Catherine is saying about the child's privacy.
Yeah. It's so hard.
It's
so hard.
So
like how far can you take it without disclosing what they're actually going through,
Well,
I guess do you let whoever's curious kind of just like keep prodding and like what if like, oh, but they might not speak the way I speak, or they might
you know what, I just say, we're working on having fun, and they're doing such a great job at this task that we're doing, and we're practicing peeling stickers right now. Can you peel a sticker? And oh look, they can peel a sticker too. Maybe this is something that you can do together in class, so it's showing.
Yeah. I like that. So like you're kind of building relatability and like being the bridge to, because they probably want a way, and adults too, want a way to interact. And I think people just don't know what to say or do, and so they just stay quiet and never approach it.
Absolutely. And then you see all the time, or you hear about on the playground, like, don't look, don't stare. And you understand the kind intent behind that of not staring at someone that looks differently. But at the same time, then you're also promoting to just ignore someone who looks differently. So it's also trying to learn how to engage. Don't stare, but walk up to someone or look at someone like you would any other person.
Right.
Right, because you feel more excluded.
Yeah.
If someone doesn't even acknowledge you're there.
Mm-hmm.
Yeah.
So it is just getting the child into that.
Are these things that your students have explicitly expressed to you guys? Like, I wish people just said hi?
Yes.
Or is it like just observational?
Both.
Okay.
I've had students who are able to share their feelings, express that. And there's one particular interaction that I can share, and it was two girls, and they were the same age, and they pretty much, they were functioning very similar. So I would see them together. So we'd go and we would do therapy together. And then one was going to move to another school.
Oh.
And she was, Miss Nancy, I'm going to be going to wherever. And the other girl looks at her and goes, and it still almost makes me cry when I think about it. She goes, so I'm going to be the only one.
Oh, no.
And so, yes, they do express it. They might not always say it as you and I.
Feel it.
But they feel it, yes.
I'm like going to cry with that.
And
it's true. And
it is.
Even if it's not verbally expressed like that, it could also just be, I had a student that I worked with, and the elevator was broken this day, which is such, this is how someone moves about the building. If they are a person that's in a wheelchair, uses a wheelchair to get around. And this particular day, there was a school parade assembly, and all the students walked up the stairs and across the hall and promoted seatbelt safety and had their little instruments and drums. And this student just broke down crying and crying and crying because he wasn't able to go up and participate. And we found a way to do it. I'm not going to say how, because I don't know if it would necessarily.
If it's kosher.
But he was very happy that he was able to participate. But knowing that in the moment when he thought he couldn't,
That's frustrating.
So frustrating.
See, and that shows you everyone wants to be included, and everybody wants to be part of what's going on.
I love that. So I think a lot about that as well. Just like try to be inclusive rather than exclusive, and like you guys are like the facilitators of that. I think you bring a lot of hope back into people that might have lost hope at one point.
Aw,
I hope so.
Thank you.
And I mean, if you really have this empathy and think about, can you imagine if your presence and existence made other people feel comfortable? Though it shouldn't. That's not something on you. That's clearly a problem or an issue with them.
Yeah.
But it's still hurtful when it's noticeable that just people don't know how to talk or interact. Or also, sometimes if people have a physical disability, there's other people that still talk to them as if there might be some kind of cognitive or intellectual disability. Not that you should even talk to someone so differently just because intellectually or cognitively they're different than you. You should still have that kindness, but to talk to someone like just assuming that they can't understand what you're saying.
Yeah. Do you guys know of any other ways that we can like bring greater exposure to these, like to the demographic, to students that want, more people in their lives?
I have a friend who is blind. We've been friends for a lot of years, and we travel together. She's an inspiration. I have to say, most people I have treated or who have known who have some type of physical challenge, they really have been an inspiration to me.
Yeah.
But in her story, whenever we do travel, being that she's blind, a lot of times a person will talk to me and not her, even though she's standing right there. And she is totally aware of it. She can feel that they're talking to me and not to her, even though she may be the one paying, talking to me. And she'll personally educate that person. She feels like it's her job, talk to me, I'm the one. And I feel like if we could help educate our students that we see to speak up, to have a voice, because I think it's very hard to have a voice when you feel like people are not,
when you're when you're like feel like you're outcasted.
I think so.
And I think when I said that initially, it kind of came out weird. Like I don't mean to just seek out people with disability for the sake of like their disability, but like I guess how do we normalize? Like, we probably want to see it in mainstream media and in shows and movies more
Absolutely.
often.
Yes.
Like, how else can we bring like greater exposure to this demographic to normalize it, to not make it so, to give them the resources to be able to interact on that level? How do we just treat humans like humans? It's just like, why is that so hard?
Like, this is a bigger question than I can answer.
It's so crazy.
It is. But I have seen that there has been improvement.
Okay.
I feel like, I see in advertisements now and TV shows, and I feel like there's still a long way to go. It's not, you don't always see someone who is independent by using a wheelchair portrayed frequently, but I have seen it a little bit more. But you are right. It is the bigger question.
Yeah. When I first started working on the ambulance as an EMT, I was surprised at how independent people that were paralyzed became eventually. And I was assuming that they would need some help getting over from maybe the stretcher to their chair to a bed, and they're like, I got it.
Yeah.
Like, oh, okay.
Yes.
And that's due to rehab. That's due to therapy and rehab.
Yes.
Yes. Yeah, and their own spirit, their own desire.
Yeah. And so I think you mentioned this last time, Kat, but like, do right after an injury, they might have lost all hope. Mm-hmm. How do you like deal with that for someone who's so, and I'm working on this, but like so logical and not as emotional? I just want to like get from A to Z. Like how can we move on and find a solution to this? And I can't just like sit with the feelings. Like how do you deal with like high stress, high anxiety, like high emotional? Because like it's hard not to take it home, right? It's not hard to like just take it and just deflect it. You have to like sit there with it. So can you like, how do you, because you've both been in hospital settings, right? So like how have you dealt with that?
Do you want me to?
Yeah, you go.
So I think your question has like two parts
Sure.
to it. So how can I have my therapeutic use of self when I am working with a person maybe in the worst day of their life, at their most vulnerable state, and then also how do I go home in my own life outside?
Sorry about that.
No, it's okay. So the first part, and I keep saying this therapeutic use of self, and I almost want to say it's something you can work on for sure.
Okay.
So I think some people have a little more of a natural sense of this quote unquote vibing with someone or kind of gauging where someone's at. I think other people really need to be comfortable with emotions and work on exploring your own emotions. So obviously, the type of person I am, I'm already pretty hopeful. Maybe some people would say bubbly, have this big smile. However, I have to be aware of maybe how happy I come across or how energetic I seem if I'm approaching someone who maybe now has lost function of half of their body and might not regain it back depending on the injury. And this person is very vulnerable. They might be wearing an adult diaper at this moment and not having control of bowel and bladder. But knowing that in this hospital setting that my job would be to help a person learn how to use what they do have function of their body and what other tools that are out there to adaptive devices, assistive technology to help a person be as independent as possible. There's hope in that. And I think, just really understanding, engaging, being empathetic. I understand, but we're going to get through this. Every day is a new opportunity to learn something new. This does not mean that life is over. You can still have a quality of life. There's so much to do with therapy. There's so much to learn. There's so much to help you. And, I think of patients that didn't believe me. I've had patients actually be really mean to me. And
did they flip like over time?
Over time.
Over
okay.
time. And what do you think it took? Is it just that much, like putting in the reps, putting in the time, or like what did you notice a tipping point at all?
I think
it's probably very it's very dependent on like the case by case basis.
Yeah, I think it's absolutely. Every day you're working on something new, and maybe when lifting a cup to pour milk into a bowl was hard and you spilled it all over and now you can do that. That's just like, oh my gosh, something that maybe most people take for granted or don't even think about being a difficult task, but just like holding a bowl steady and pouring with the other hand, like, oh, I could do this. So like, what else can I do? And seeing how you're building and growing. And, the body is an amazing thing. Just, neuroplasticity, how much the brain can learn and mold it at all ages, really. And then to take it home, that's a great question. I think I just have pretty strict discipline of a work-life balance. I'm always passionate about others and caring about others, but I also, I get involved in my own life as well, like with acting. I have different hobbies and leisure, and so ways that I can channel all these emotions I have with it.
Right. I didn't think about that. That's cool.
Or working out, for some people, and it's. I don't know.
Well, I feel like for me, there was this book I read one time, and it was called Expecting Adam. Not to summarize someone else's book, but in gist, I think her last name was Beck. I'm not sure, Martha Beck or something, just to give some credit to that author. But she was pregnant with a child, and she knew the child was going to have Down syndrome. And it was her journey of accepting the fact that she was going to have a child with this diagnosis, and how so many of the people around her wanted her to abort the child. Well, she ends up having the child, and then the book goes on about her struggle of coming to acceptance. And she was in a physical therapy session with her child, and the therapist said to the mother, "You are so lucky to have him." And she started to cry because she goes, "You chose this as a profession. I didn't choose this for myself." But in a way, I think that kind of summarizes how I feel. I mean, I chose this as a profession. I feel comfortable with people who are challenging and struggling to get back to a level that is independent and functional for them. And I always feel like I have such beautiful stories when I think back on so many of the adults I have been with, and so many of the kids. And that's what I do. I guess if I take it home, I would take it home like going out with you, and you share stories with me, and I just remember them and just think of them, and I just think of them in a positive way.
Okay.
It's not depressing to me at all, if that's what you were.
No, absolutely not. I guess, yeah, I was just coming from the like other healthcare perspective, and like you see more negative than positives, I guess. And I guess that's what could be more stressful. But when you're surrounded by just hope, it's like, that's awesome. I would love to take that home.
Yes, exactly. Yeah. You're right. You are surrounded by that. That's so true. That is so true. And then someone like you, who you said you're not really an emotional person, then we'd have to try and find a way for you to...
You're gonna open the floodgates?
Yes.
There's a lock in there.
Not even so much your emotions, but just I could see where someone like you would be easy to work with in terms of physical therapy, because I feel like you would have a goal every day, and you would want to achieve it. You would probably work me very hard. But as far as the emotional part, maybe you would only open up to your friends and family. Maybe you would not share something that you were feeling. But I could see a person like you just would be very motivated to do.
Pretty spot on. What do you think? Before you went to school for this led to your success? Like, is there anything that pre-OT, pre-PT students should be doing prior to embarking on that journey? Anything extra besides that track?
I think for myself, I always knew I wanted to be in a helping profession. And then all I could see was nursing, and I really felt like I really wanted to be a nurse. But to be honest with you, I couldn't pronounce the medications. I really can't. I can hardly pronounce a lot of words still. But after my father had his stroke and the physical therapist would come to the house, I thought to myself, no, that's something that I could do. That's something I could do. Yeah. I don't have to be able to pronounce the big words. I mean, I grew up in Western Pennsylvania, so I didn't have to pronounce the big words. I'm just going to have a conversation with people, and we're going to be like a team.
I love that.
So I guess my advice would be, if you really feel like you want to go into any profession, in a healthcare profession, volunteer.
Yeah.
Make sure that's what you really do like, so that you don't walk in the first day and then you are offended by someone who needs to be cleaned up, or you have a hard time if somebody throws up. See, those are things that don't bother me.
Yeah.
So I think it's the biggest thing would be your ability to connect with someone.
Are there like databases or like areas where people can reach out to practitioners to seek volunteer opportunities? I just feel like, and this is like, back in high school and even college, it was so hard to, you feel like you need to know someone. And I wonder, or maybe I just couldn't find the database.
No, I mean, I think that's a great question. I don't know if there is a specific...
It probably depends on the setting too. It's probably a little harder to get into a hospital setting, but like outpatient or home health, it might be a little easier, maybe. I don't know. Yeah,
and I was fortunate that my mom was already a physical therapist, and growing up, and since she worked in the school setting, it was, pretty easy. Just, she would talk to the principal, maybe sign a form that I'll be visiting the school, and I was able to volunteer. My mom being a physical therapist, I would see so many different types of people. Like she mentioned, she has a friend who's blind, or as she built rapport relationships with other people, I got to just have this be part of my life growing up, with a great opportunity to volunteer. However, I'm thinking, maybe emailing and reaching out to some facilities, noting that you want to volunteer, seeing what's available. I'm thinking if there's also volunteer organizations as a whole that kind of have a database in their own of where you can volunteer.
I'm sure there are. Do you know of any, like for specifically within the rehab world or therapy world?
I don't know of one specifically, but a lot of times if you call, especially extended care facilities, and you say you would like to volunteer, I don't really know what the process is now, because it seems like everything is a little bit more rigid at the moment as far as getting in, but they may be able to direct you.
Sure.
Well, and I know that, and I don't know if it's geared more so if you're a student already in this profession, but there's also people that look for some respite or companionship for, geriatric population. I have a friend who does that, where she'll visit someone an hour a week and just hang out. And I think that might be, you're already there and getting a good idea of what they can do, what they need help with, maybe seeing some of the other people that come in and out of their room. But I completely agree with my mom in the sense that really get to know each profession, because it's not all just the same of what you're doing.
So nuanced too.
Yes.
Is it, I don't know if I remember this correctly. Did you spend time in hospice?
I did.
Okay.
I did, but I was a hospice volunteer.
Okay.
Yes,
How was that experience?
I really did enjoy that.
Yeah.
It was, I only did it for about a year. It can be a little bit overwhelming. The thing that I found, because I was there to give the family members a chance to maybe sleep or go get a meal or just to get away for a little bit, but they never wanted to leave.
Yeah.
So I felt like I was more there for them, that they could have a conversation and just talk about how exhausting it is taking care of somebody at the end life. But it was, I feel like it was a gift to me to be able to be with people at the most difficult time in their life, where they're trying to say goodbye to someone. But it was a beautiful experience. But
did these patients was there a common thread between these patients? Did they have like if they were to reflect on their life, is there any common thread?
That's a good question, and I'm going to have to think about that for a little bit. But
any regrets
with the hospice training, we had to read a book, and it was called The Final Gift. It's because everyone at that time seems to have something that makes the transition easier for them. Like if it's a son that they haven't spoken to for years, or if it's just letting everybody know how much you love them or appreciated them, or how thankful they are for them being in our life. But you are right. There is something. It wasn't revealed to me by every patient that for that short time that I was able to spend with them. But yeah, everyone does have something.
We're all gonna die eventually.
Yes.
Did it help bring a certain level of whoa, I gotta make the most amount of my time here?
It does.
A certain amount of gravity to it, right? Yes,
it does. But you have to keep reminding yourself of that, though, daily. I feel like it's very easy to slip back in. You have something on the back of your shirt that talks about the mundane, and that is the goal we should all have, is making the mundane feel
exciting.
And
and I think that's true. And I remember a story you told me, and some people you saw at the end of their life who maybe they didn't fulfill the things that they thought they would, or maybe because of temporal, social, cultural, that they weren't able to. Maybe an older female who wanted to go out and be a big writer or do something great, and rather maybe, and not to say, of course, being a mother and a homemaker is not great, but maybe if that's not what you want to do, you would feel like I did what society thought I should do as a woman growing up in this time. And I remember you were mentioning someone saying how high school was the best time of their life.
Yes.
And to me, that stuck with me because I thought, oh my gosh, so anytime I catch myself really thinking college, that was
missing a time.
Those were the best years.
Really, they were.
Because you think, wow, so 14 to 18 years old, and then it's just been you have not found as much joy and happiness within your life as that time, and now you're in your 80s. So, I mean, it's something to work on every day, but just being so present and mindful and just finding the greatness of your everyday life. I don't want to be looking back and think that was the best time of my life. I always want to be living the best time of my life.
Absolutely. Sorry to get off track a little. I love these things. I love.
No,
but it's still
that is on track. So go ahead.
Yeah, like a rude awakening thing. Yes. Just like snap out of like the complacency and like realize like this is all we have. For all we know, like this is all we have, and make the most of it.
Yes.
Right.
But I guess tying it back with the industry, are you guys like hopeful about the industry, like with the future? Like how has quarantine put a hindrance on like what you do on a day-to-day basis?
Quarantine has been very difficult for me.
Fall has started, right, for the school?
On Monday.
Oh, okay. Monday. Gotcha.
We start, meetings, and so I think the kids come back after Labor Day. So.
Okay. Yeah. Tell me, how is it?
Well, part of it has to do with my age, because I think younger therapists are able to embrace teletherapy, and I'm a hands-on person. I really like to be where I can physically be touching and helping. Yeah. And whereas the teletherapy, if you're helping the parent facilitate the therapy, which is a great learning experience for them, but it's not as satisfying for me. And to be honest, at the end of the school year, a lot of the parents, it was just too overwhelming for them. So a lot of our communication has just been email, suggestions. So it's been a whole new ballgame for me, and I'm just looking forward to being back with one-on-one with the students and being with my coworkers, and
right.
just being back in the work environment.
We
for
need
me.
that human connection.
Yes, we do need that.
And I think there are a lot more barriers than
you would think like, oh, everyone can talk over the computer now. It's like it's
with therapy. Now, granted, there are you can go into telehealth and teletherapy, and that's a specific thing. But keep in mind that I'm sure the program is what it is. You have families that also sign up for this. And I think there's just more of a
expectations when expectations are
you're going into the known, whereas this was unknown completely for everyone. Right. And it, we didn't have training on teletherapy. And then there's so many external barriers that we have to navigate. Keep in mind, internet service. Not every family we work with has internet service. Keep in mind, there might only be one device for a home. And if this is a multifamily home, or if there's many children in the home, maybe the older children need to use the laptop or computer or iPad or parent's phone or whatever to access their curriculum.
Then does that fall on the family's responsibility? It does, right?
I do feel like the school district is trying to help out with that. Okay. I think they are, but I'm sure since this was something that was thrusted on everyone, it was something you really couldn't.
It's so fast, I know.
Yes. Anticipate how quickly can you put all of those needs in place.
And so does that cause you to spend more time? Like, it just like things get backed up on your end when they can't keep up?
Well,
I feel like it's the teachers have really been the ones that have had the most difficult time because they have the whole classroom that they have to try to find ways to engage. And it's just been difficult. I really don't even have a specific answer for how all of these challenges are being met and how they are going to be met. It's been difficult.
And I would say out of, let's say, 60 kids on my caseload, I've been able to maybe contact all the families via email or maybe through a meeting. But I, with the teletherapy, maybe have only been able to see 10. And granted, this was before the school year ended. So I hope that starting this year, I'll have a better flow. Maybe there's going to be more hotspots for internet. But you also have to keep in mind supplies. It would be wrong of me to look up a fun craft to work on visual motor and, fine motor and bilateral coordination skills. And then to tell a family, okay, make sure you have glue and scissors and tissue paper and the little eye thing. It's too much. It's just really too much. So it's also working our wheelhouse of how can we get that creativity and do something therapeutic. So I would try to do motor activities that did not require supplies at all. So we would do virtual dice games, and depending on how the dice moved, it was a different yoga pose or movement. And, and I would also work with the PT that I work with in the schools, and we would consult. We were able to kind of observe a child in a wheelchair and hear the child and parents' concerns of maybe a misfit of the wheelchair and contact the vendor. So, in those ways, it was a very consultation, a lot of check-ins. I provided a lot of packets and resources, but you do feel a little helpless during this time. And what you can do, even more helpless than sometimes maybe when you feel overwhelmed when you are in person.
Wow. And if you what would you decide you would want to do with the school year or with the school semester right now? Do you feel like there are means to have a safe environment for the kids to come back? Or is there just so many kids?
There are a lot of kids and there are a lot of factors involved.
Yeah.
I sort of was hoping that we would go back.
Yeah.
Because I know when I listen to what the medical professionals are saying, they talk about how children aren't really as susceptible as adults, and they may not even be carriers. And so I think that would be nice then if we could go back, but then there's the factor with the adults who maybe are more vulnerable, and they're still around the other adults, and I know everybody's trying to be as socially distanced as they can and wearing their mask around people that they're not living with, and the hand washing and that.
Right.
But I also think about if students have to wear their mask all day, that's a challenge too. So I really don't have a specific answer. Yeah. My desire definitely is to go back and be with the kids. That's really what I would like.
I guess safer is obviously safer.
Yeah, exactly.
And my desire would be to go back, of course, and it's just your job is, like I said, it's just what it is. It's how it should be.
Yeah.
However, you just want everyone to be as safe as possible. And I think there's so much unknown, and you hear so many different doctors' opinions of how the children, if they can't carry, how it affects them, who knows. And before it was like they weren't really affected, and then it was, some kids are having strokes. So it's just all this back and forth. And then yes, if you think about so many adults that go in and out of the building, you have clinicians who go to multiple schools, touching different supplies, sharing supplies, parents coming in and out, custodial staff, cafeteria staff, teachers, substitutes. That's just, I'm not even naming everyone. And then the lunchrooms. You can have 800 kids in a school, 1,000 kids in a school. And so, and then kids keeping masks on every day. I can't picture that. And I think even some of the kids that we work with, if there's some oral motor, if there's a lot of drool or respiratory or any diagnosis where there might be, or sensory, there's a lot of components that a child wouldn't wear a mask. And then I think of the unknown of a virus. I think I talked to, there's, some viruses that can affect the nervous system pretty harshly. And I've seen that in kids too, that a virus has kind of attacked the nervous system, and there's onset of paralysis. And so you just want to be careful for everyone. And kids, even if they go home, and who knows where their families have been out in the community. And so it's just, it's so hard to regulate in the school-based setting. So, but who am I? I don't know.
It's like, if you were a lobbyist, what do you think, maybe another, a consistent stimulus check, but then what are your thoughts on taking the school year and just nulling it, or how does that work? I feel because there's a ripple effect with all the way to college, of just people missing out on the school year, and they just don't feel like they're getting the same education via online rather than in person, and you just feel behind.
And so everyone, if you're just like, oh, it's kind of canceled then. Like, how does...
Yeah, that's a hard question to answer, but I also think everyone will kind of be like, right, we're all going to be behind together.
Yeah, right? That's the thing.
I don't know that. I mean, yeah, there's so many variables. Because
right? Like parents have to work.
Parents have to work. And also when you think of regression, with the population we work with, some students, you do not want them to miss instruction, and we advocate for going to summer school so that they maintain these skills that they have learned, and they're still getting PT and OT and some special education during the school year. So I think, that's what's, it just sucks all over. There's really not a good answer, because I do see what you're saying. There's a population where there is going to be regression, and that's going to take a lot to come back. Or I think of students that, they went from being able to hold a pencil, let's say, like I said, this is a common thing I hear, and barely being able to apply pressure, and now they're holding it and putting more pressure, and they can finally write their name. Or students that weren't able to hold scissors and a paper and cut, and they were starting to cut circles. Students that were able to put their coat on and zip it by themselves. And I do think of that.
That's nice. But these are things that you can do on your, like, they can practice. They can practice at home, and you just hope that they do.
Yeah, or that the environment that someone lives in has the supplies and there's so much
out of your hands.
Yeah,
I just feel like I can't. Yeah, helpless. You said.
Yes.
Okay. Well, when things return back to normal, are there any things that you wish you could do that you can't do at the time? Is there any part of the job that might be frustrating? Things that coming into the job you thought you could do, and then you're like, why can't I do this?
You mean in terms of telehealth that we can't?
I think in general.
In person, like when like things were back to normal, or when they do return to normal, it's like, was there any part of the job that you thought you would have been able to accomplish within your role, and like you just feel limited in any capacity?
Let me think about that. Do you have an answer?
Well, I think in our setting, sometimes supplies and equipment.
And that's aside from the teachers getting their own equipment.
Right. We have X amount of dollars a year to buy things for ourselves, but often we're maybe spending more. And I think the allocation of different resources isn't necessarily, equal.
Yeah.
So, another population I might work with is students with ADHD or students with autism. And if there's a sensory component that comes with that, a lot of people are like, well, sensory rooms. And I mean, that's kind of its own other beast, but some schools might have a sensory room where you can go and you can kind of promote and apply true sensory integration models, or knowing if a child needs...
I've never been in one. Can you describe what one could be like?
Yes, and I actually have never worked at a school that has one. So, but of course, I'll just talk about sensory in general. Sometimes your body perceives sensory different. So you might be seeking something, you might be avoiding something. And if I were to give you a sensory profile, everyone has their own little preferences and aversions, So when it becomes where it impacts your function is what I really want to look at. So let's say, we could be sitting in this room and there's the bright lights coming at me, the vent might go on, I can have these headphones on, and my body can integrate. I can concentrate on this conversation with you. However, for someone, that vent might sound almost like airplane jets. These lights might feel like the sun, it's too much, and I might not be able to work or concentrate. It's like almost painful. So with sensory, you want to be able to help regulate the body and modulate the body and promote.
So they have control over different aspects that reach the sensory.
Well, so
the senses.
So for example, maybe if the light felt bright, I would recommend to a teacher get those dimmers. Either turn the lights down, or there's those those clear or colored sheets. I don't know if you've seen them. You can just put over some headlights, and then they make the light a little, so you could still see, you could still function. Softer light.
I thought it was a dedicated room. Then you like apply it to other settings.
Right. So there is a room, and the lights could be dimmed down, and maybe there's some of those tube lights, or there's headphones, maybe you can go into the room, and there's swings. So if you are having a hard time knowing where your body is in space and you're come across as clumsy and you're falling out of your chair, so getting more of that proprioceptive input, knowing where your body is. So there's tools in a sensory room that's just almost like a calming room.
Yes, it could be a calming room, or it could be a room for students who need to have their bodies awakened.
Wow.
So
Yes.
it could be, it's just like deep pressure to calm them down, but
Yep.
then maybe movement to wake them up.
Oh, wow.
It's so subjective of what everyone needs.
It is, yeah.
And you can even have let's say if a student needs movement to wake up, you can also move too much and be overstimulated. So it's really knowing what your quote unquote sensory diet is. But I don't have sensory rooms in the school that I work in. I think sensory, at least for us in our school district and school-based setting, is very consultative. That's a model that I like to use when it comes to sensory and using accommodations and modifications of the environment. The environment is very important, especially in occupational therapy, and how a person is responding. So like I said, if it's a classroom and it's like, well, they're moving a lot, or they're falling out of their seat, or they're complaining about light or scream, just kind of seeing, well, what could be looking before this. And also not everything is sensory. I do want to say that. You have to look at the antecedent behavior and then the consequence of what follows. And, looking, is there attention-seeking behavior? Is there, empowerment, escapism, and sensory could be a part of it, but it's not everything. But when it is sensory, definitely trying to find a way to regulate and modulate the body.
I feel like a lot of people can benefit from something like that.
Oh, trust me, I know. I get a lot.
I've recently played around with like breath work and like using it as a way to like bring somewhat of a sense of control back into you when like you feel like so much is going on and things are out of control.
Yes.
Have you found other ways to implement an ability to gain a sense of control back in addition to breath work to the students? Like to bring to give them some control. Like how do you, when they feel like something's like it's so chaotic, how can they reel it back in?
Well,
no, I was just going to say, when you, just to piggyback on what you said about what you wish you could have when you go back that you don't always get.
Yeah. Oh, yeah.
Yes. And then I think it'll tie in with that breath work too, because I do what you were talking about, the creativity. I like to come up with different ideas on how to, if not to facilitate therapy, or to make a student feel, part of the therapy in some way, or to try to do something innovative. And one of the things that I was doing with my coworkers is we were trying to do yoga on a regular basis, and that's what brings in the breath work and everything. And yoga is something that a lot of students, even though they have a disability, can also do with their peers. And it always started, I guess the word is enthusiasm. I wish that sometimes whatever school I was in would embrace some of my ideas instead of yes, that would be it.
And it goes along with the supplies, because we would love to have more yoga or more whatever in schools, but it's not so easy to just be like, I'm starting yoga or I'm making a sensory path. You really, that's going to cost money. You need space. You need to be approved, so it's not so simple. You might have all these tools and ideas as a therapist, but you still have to work under certain guidelines. And I think that could feel a little suffocating. But yeah, yoga is a great tool that works really well with kids. And there's been research for sensory modulation and attention, and and it's also very proprioceptive, very core building. So you're getting pretty much that whole gamut. Things I recommend to teachers are the wheel of choice.
I like that. Yeah. So but like, what does that mean? So they spin it?
Yeah. So I think it's fun for a child because they can spin it, but it also has choices that you as the adult, you're still guiding, you're still the adult of the room, but it might be, do you need 2 more minutes? Set a timer, 2 more minutes, come back to the carpet, or, and there could be a third one of, it's what's specific to the teacher's classroom, whatever they need, or go to the center. So it's kind of like you're giving them options that are helpful for both of you, but then the autonomy is also on the child, so they feel part of that collaboration.
The act of spinning?
Yeah, the act of spinning, and then
it brings control.
The act of spinning. The act of spinning, or I think it's just a personal thing depending on the age. Giving a child so many choices is overwhelming, and I think
Are you guys keeping a list of all these things that you wish you could be doing? And like, can you imagine like you come as a collective with maybe other practitioners or maybe just you two and like just do your own thing, like what if you like formed in like an outpatient group and you're like, we just need the funds now and let's just do our own thing. All the things that we couldn't do before.
Yeah.
I
Yeah.
we have talked about it with my coworkers, and not just that, yoga. Like the thing with students, particularly young people, they have therapy all their life. They get tired of doing just gross motor skills, and so it's always nice to find something that is different, but still gives them that therapeutic need. Like the yoga, like I said, dance is another great thing. Getting them involved in dance. I mean, I would never be able to participate in swimming, but there's some schools that have swimming pools, and getting the kids involved in a swimming activity, horseback riding, anything like that, where you still are getting therapeutic benefit, and maybe even a lot more than what we're giving them, because it's something fun. So it's something that they would really have a buy-in to.
Right.
So those are different things that I really would like to see facilitated. And another one, I read an article in Reader's Digest, and it was a photographer, and I think he was out of Poland. But he would position kids where they would look like they were flying, or they were putting a ball into a basket, and somehow he would climb up on a ladder and he'd take the photos from above, and you'd have shadows and everything. You probably understand it, Victor, because you're and I've always wanted to do that for the kids, but I just can never seem to get too much buy-in. I just thought it would just be so interesting. Like if a school photo could look more like an action shot than a still shot. But those are just some of the. And you can't always expect people to be enthusiastic about what you think is.
It's unfortunate, but it's probably not until someone who has that authority or power is personally affected by something like this.
Yeah.
And they themselves are seeking what you guys are trying to put out into the world.
Yeah. And I mean, some people are so creative with grants and are so open to it. It's just, and it's hard. I've been open and honest with you just about those barriers. When you're traveling to so many different schools and you have so many meetings and so many reports to write and notes to write and seeing kids, I mean, there's still a lot into the job. So as much as it sounds fun to create these different things, there's also a barrier of time and resources, to be honest.
Yeah.
But it is...
you want to do so much with so little time, but at the same time, you did share that you have an ideal work-life balance as well, which is like important to be able to take care of yourself before taking care of someone else.
Yes.
And were there other parts of the PT/OT world that might not share that same work-life balance?
I mean, you would probably know more, because I've mostly worked in school-based. I've always had those school hours and summers off and holidays.
I could see where the hospitals are over.
It's just year-round then, and then you just build up vacation time and
exactly
weekends, holidays.
Yes, because I mean, I was a lot younger when I worked in rehab, and I still remember coming home from work and being so tired, but I'd want to spend time with her, so I just asked her to go sleep on the bed with me, and then we would talk, and we would do just those little puppets, shadow puppets and things on the wall. And she was always very good about it, to be a 4 or 5 year old girl and just be okay, just because she wanted to spend time with mom. But I remember, I mean, and I was young, so I do know it has to be overwhelming for the therapists to work in hospitals. It is hard work.
Is there anything else that you want to add? I know we talked briefly about the distinction between like a doctorate and whatnot, and like, does that matter too much anymore these days?
I told Victor that it's a little controversial.
Is that a big deal? Like, as long as you're doing the work, or
it's not a big deal to me, because I started out with a bachelor's degree, and my father-in-law, who can be very funny, he would always say, "Are you a doctor, or are you a doctor dentist?"
Oh,
so I kind of agree with that. I think it's not so in. The education is important. It's good to have that. I'm not trying to diminish that. But as far as having the title, it's not so meaningful to me. I don't know if younger people...
Because you went back to get it, right?
I went back.
Now, how much of that was like redundant? Because you've been practicing.
It was. It was.
That's what I thought.
It was. And it was just...
I feel like because nurses go through that right now too. It's just like going back to get their BSN.
Yes.
Huh.
Yes.
But I mean, I'm proud. I'm not like I'm happy. I went to a school that had one of the first doctorates to offer for occupational therapy at an entry level degree.
Okay.
I do feel like I put the work in, and there's still a lot of time and energy. However, like I told you, I would never have the audacity to think that, coming out of school, and if I, let's say, went to any setting and someone had a bachelor's or a master's in OT, that I, knew more just because I had a doctorate. You know what I mean? Never. And there is, I think I told you, that controversy in the industry because PT is now terminated into a doctorate. So when you go to PT school, you will have a doctorate degree. This is not optional. So back then when my mom was going, it did terminate a bachelor's, and then, then you can maybe get your master's. And now it's completely, you will have a doctorate as a physical therapist. Occupational therapy is not the same. There was a goal, I believe it was by 2025, they wanted it to be like PT, where if you go to OT school, you will end in a doctorate. So that is not the case yet. When I started, there was only 5 entry-level programs, I believe, 1 to 5 entry-level OT doctorate programs. Granted, there are more post-professional doctorate programs for people to go back, but you can still terminate in a master's in occupational therapy.
Are there different tiers to salaries with respect to your level of education?
In the school base, yes.
Okay.
So we have lane and steps, and we have a higher pay lane for having a doctorate degree.
Interesting. Yeah, as a paramedic, it's not even it's not associates. And so I wonder if they turned it into like at least a bachelor's or something, and like, you got to think about all the other classes you put into it to turn it into a bachelor's. But if it would bring like a certain amount of validity to the profession, and at the same time, I've met amazing paramedics that never went to college and they just became a paramedic. They became an EMT at 18, went straight to paramedic school, and they're doing what they love to do.
Right.
Might not be making the money that you should be making.
Yeah.
Right.
Yeah.
Right. And then you think
so like what I'm saying, I guess education doesn't always correlate to an excellent product or an excellent service.
I agree.
But there's truth to like the amount of money you can be making depending on how much education you have.
Yes, and unfortunately, just what you said, it seems to add respect the more education that you have. And I agree with you. There are probably a lot of, if you love the job, a lot of the people that you teach, they're gonna do just as well on the job as somebody who had more education. I just don't know that more education always does equal a...
Yeah, I don't know.
But there's debates. I always looked on the Facebook comments of certain OT,
okay.
And I know when I was in OT school, I think we were really told about how to defend our doctorate. And unfortunately, I'm like, what was the arguments?
So people were trying to take it away?
No. I mean, defending it in terms of
like making everyone like at that level.
So the argument, I think, if everyone has a doctorate, then then why even go for a doctorate? Why is everyone? You're just everyone's.
Yeah.
Then what? But I think also
like everyone would be grandfathered in.
But I think there's also people on the flip side, like not like my mom, but are just like, oh, like you got a doctorate? Why'd you get a doctorate? You could have got a master, And I think it's also learning how to defend and why you got a doctorate. But don't ask me to defend myself. It's more of like I was very fortunate to just went for it and got accepted into this program.
Yeah,
and this is just kind of the path that happened. And I'm proud. I am. I'm happy.
You guys are doing great work.
Thank you.
That's all I had, guys. Did you have any questions at all, or anything you want to add?
Maybe just
Yeah. What's the title of the book? So I don't know if the camera can see it. I think. What's Wrong with You, by Nancy and Catherine, Crivellone and Dail.
Should I read the back of the?
Please do. Yeah.
Okay. The authors have experienced or witnessed a child who looks or acts differently being asked, "What's wrong with you?" Although the intent may not be malicious, this question can be hurtful for the child who has a physical, cognitive, emotional, or sensory challenge. The purpose of the book is to raise awareness of the capabilities of children with diverse abilities. This book will educate children on interacting with a person who moves, looks, or acts differently. Children, students of diverse needs and abilities are still capable and desire the same experience in life as their peers. The authors would like to illustrate what others may perceive as a children's weaknesses can actually be their gifts to us all.
That's awesome.
Is there something you'd like to add?
No, I just want to thank Victor. This has been great.
It's been an honor.
Yeah,
Thank you.
Appreciate it.
And can we find it anywhere besides Amazon?
Yes. So right now, this book, What's Wrong With You, is as well as Amazon, but it's on Apple Books, and Barnes & Noble.
Are we going to get an audio version eventually?
I know. I'm like, I want to get an adaptive version.
But it's so visual too. It's interesting how that could be.
Yes. And we also would really like to get into smaller, locally owned businesses and bookstores as well.
Yeah.
And, bookstores in the community. We would like to get this out as much as we can, and especially into schools. I think this is perfect for classrooms, perfect for parents. And, the illustrator, Luis Castillo.
Yeah.
He is a special education teacher that I work with at one of my schools. So that's another little special touch to the book, is you have a mother-daughter physical therapy, occupational therapy duo with a special education teacher who illustrated. So it's great.
Well, a huge congrats, guys. Thanks for coming on. I think I got a lot of value. I hope the listeners got a lot of value out of this.
I hope so too. Thank you for having us.
No, it's huge. Like we talked about before, like a lot of people still don't know the distinction between the two.
Oh.
Although there's a lot of overlap, there's still some nuances
that
separate the two. But continue doing good work. Good
Thank
luck with
you.
the fall.
Yes.
Thanks.
Yes.
But I hope, don't, and you won't, but like lose hope in that sense of like fulfillment. Although we miss that and need that human connection.
Yes.
It's more for them than for us, right? It's more for like the students.
Yes.
Right?
Yes. Yes.
So
Yes.
whatever's in their best interest.
Exactly.
Yes.
That's exactly it.
And just keep in mind that people with disabilities still desire the same things that we all want out of life, to participate, to have friends, to have meaningful relationships, to feel fulfilled, and like with having a purpose. It's really what everyone wants.
Yeah.
So just because, again, you look or act or think differently does not mean that's not a desire.
Right. Absolutely. Okay. Well, thank you guys. We'll see you in the next episode.